Well, stroke is a growing health concern for many Americans as they age. According to the CDC, more than 795,000 people have strokes in the U.S. each year, and it is the leading cause of long-term disability. World Stroke Day is tomorrow, October 29th. Joining me now is Dr. Frei, a neuroradiologist with Swedish Neuro Network. Thanks so much for being here. We appreciate it.
I'm happy to be here.
So World Stroke Day meant to bring awareness to individuals to be prepared for a stroke. We're looking at a graph right now with the acronym BFAST. Can you explain what this means?
This is an easy way to remember the signs and symptoms of stroke. So B is balance. If you see someone that's imbalanced, that could be a sign of stroke. E is basically eyes. So if someone's having trouble with double vision, blurred vision, loss of vision. Face is asymmetry in their smile. They may have a droopy lower face when they smile. So that's face. A is arms, so if they're weak in one arm or the other. S is speech, so if you're having trouble speaking, slurred speech, inability to speak. And T is time, call 911. So these are the typical signs and symptoms of stroke. And one of the things that's so important is that stroke is a major medical emergency. Time is of the essence. You lose up to 2 million neurons per minute if an artery in your brain is blocked. So the faster you can call 911 and get a patient to a center that can treat stroke, the better they're going to do. The longer it takes to recognize and activate EMS, the less likely someone's going to recover.
So those are the signs. Who's most at risk of suffering a stroke?
Most people think that it is only in the elderly, and it certainly is true that elderly people may have a risk, but I've treated patients as young as 9 years old. So anyone could be at risk of stroke. If you have risk factors for atherosclerosis like smoking, uncontrolled high blood pressure, if you have a clotting disorder or have something like atrial fibrillation, these may increase your risk. But it's not just for the elderly. It really, stroke can affect any age group.
And then, so what are the treatments if that is the case?
So there's an intravenous clot-busting treatment that can be given within 3 hours of onset of symptoms. There's another treatment that I do called thrombectomy, which is inside the artery, removal of the clot that can be done up to 24 hours. So there are different types of treatment. The key is to get someone to a stroke center fast. I mean, our stroke center is a comprehensive stroke center or a level 1 stroke center. So we have all the capabilities. So if you're new to Denver and you are worried about this, understanding what hospital or hospitals near you that have these capabilities is a really good idea.
All right. Well, hopefully we can bring some more awareness. Dr. Frei, thanks so much for your time today. We appreciate it.
Happy to be here. Thank you.
All right. And don't forget, you can catch all our health interviews right now on cbscolorado.com.